Today we will discuss about the cranial cavity. Now here you can see this one is the cranial cavity, also called brain box. Why it is called brain box? Because it lodges brain. Now there are three parts of cranial cavity. These are anterior cranial fossa, middle cranial fossa, and posterior cranial fossa. First of all, we will see the bones that take part in formation of this cranial cavity. From anterior to posterior, these are this green color bone is the frontal bone. This red color bone is the cribriform plate of ethmoid bone. This whole yellow color bone is the sphenoid bone, which has three parts: body of sphenoid bone, lesser wing of sphenoid bone, and greater wing of sphenoid bone. Then here you can see this purple color bone is the temporal bone, and here you will see its three parts: squamous part of temporal bone, vitreous part of temporal bone, and mastoid part of temporal bone. And laterally you will see some part of parietal bone on each side also. Then posteriorly, this orange color bone is the occipital bone, and it has two parts: squamous part and condylar part. Then we will discuss about each fossa one by one. First of all, we will discuss about the anterior cranial fossa. Now here you can see this one is the anterior cranial fossa. Now boundaries of anterior cranial fossa are anteriorly, and on each side it is bounded by frontal bone. Then posteriorly it is formed by less posterior free border of lesser wing of sphenoid bone on each side, anterior clinoid process on each side, and in median area by sulcus chiasmaticus. Actually, this one is the lesser wing of sphenoid bone, and this lesser wing of sphenoid bone medially ends into a projection. This projection and this projection is known as anterior clinoid process, and this is the posterior free border of lesser wing of sphenoid bone. So posterior boundary is formed on each side by posterior free border of lesser wing of sphenoid bone and anterior clinoid process on each side, and in median area by sulcus chiasmaticus. Then floor. Now this one is the floor. How the floor is formed? Floor is divided into two parts: lateral area, right and left, and median area. Now lateral area is formed anteriorly by orbital plate of frontal bone. Now this orbital plate of frontal bone separates this anterior cranial fossa from orbit. Then posteriorly it is completed by lesser wing of sphenoid bone. Now in median area it is formed by anteriorly by the cribriform plate of ethmoid bone, and posteriorly it is formed by jugum sphenoidale. This is the jugum sphenoidale, and it is the part of body of sphenoid bone. And below this jugum sphenoidale there is location of sphenoidal air sinuses, and the sphenoidal air sinuses are separated from this area by jugum sphenoidale. And this cribriform plate of ethmoid bone separates the anterior cranial fossa from nasal cavity. This one is the nasal cavity, and this cribriform plate separates it. Then we will discuss about its different features. First of all, anteriorly you will see this is the frontal crest. Then behind the frontal crest, this foramina is the foramina cecum. Then behind the foramina cecum, this projection is the crista galli in the cribriform plate of ethmoid bone. Now this cribriform plate of ethmoid bone has many holes through which olfactory nerve rootlets enter into the anterior cranial fossa. And this cribriform plate of ethmoid bone laterally articulates with the orbital plate of frontal bone. So laterally at articulation here and here are the location of anterior and posterior ethmoidal canals through which anterior and the posterior ethmoidal nerves and vessel passes. Then posteriorly this part is the jugum sphenoidale. Now we will discuss about the middle cranial fossa. This one is the middle cranial fossa. It is butterfly shape. Now anterior boundary of middle cranial fossa is by on each side by the posterior free border of lesser wing of sphenoid bone and anterior clinoid process, and in median area by sulcus chiasmaticus, while posterior boundary of middle cranial fossa is formed by this whole area. Now here this one is the vitreous part of temporal bone, and this is the superior border of vitreous part of temporal bone. So posteriorly on each side it is formed by superior border of vitreous part of temporal bone, and in median area it is formed by dorsum scelli. Now this dorsum scelli is the part of body of sphenoid bone. Then in lateral area, now this one is the lateral area. In lateral area on each side, this middle cranial fossa is bounded by greater wing of sphenoid bone, squamous part of temporal bone, and parietal bone. Then floor. Now this whole is the floor. In the median area, it is formed by body of sphenoid bone. In lateral area, it is formed by greater wing of sphenoid bone, squamous part of temporal bone, and anterior surface of petrous part of temporal bone. Now we will discuss about its features. Now in the median area in body of sphenoid, features from anterior to posterior are, first of all, this sulcus is the sulcus chiasmaticus or optic groove. Now this sulcus chiasmaticus on each side leads into optic canal. Now this one and this one is the optic canal through which optic nerve passes. Then behind the sulcus chiasmaticus, this tuberculum is called tuberculum scelli. Now lateral end of tuberculum scelli are projected, and here it makes the middle clinoid process. Then behind the tuberculum scelli, this fossa is the hypophyseal fossa that lodges the pituitary gland. Now behind the hypophyseal fossa, this part of bone is dorsum scelli. Now lateral end of dorsum scelli here and here again projected, and they form the posterior clinoid process. So remember here that there are three clinoid processes: anterior clinoid processes that are the medial projection of lesser wing of sphenoid bone, middle clinoid process that are the lateral ends of projection of the tuberculum scelli, and posterior clinoid process that are the lateral ends of dorsum scelli. And here remember something more, that this tuberculum scelli, hypophyseal fossa, and dorsum scelli, collectively they are known as sella turcica. Now laterally. Now in the lateral area, here you can see different foraminas. First of all, just below the lesser wing of sphenoid bone, this elongated foramina is the superior orbital fissure. Now behind the superior orbital fissure in a row, there are three foramina, and you will remember it by rows: rotundum, ovale, and spinosum. R for rotundum, O for ovale, and S for spinosum. These are located on lateral area from anterior to posterior. Now medial to foramina ovale, this foramina is the foramina lacerum, in which carotid canal opens. Then behind the foramina lacerum, this groove is the groove for greater petrosal nerve, because greater petrosal nerve goes towards the foramina lacerum. Then behind the foramina ovale, this groove is the groove for the lesser petrosal nerve, because lesser petrosal nerve goes to the foramina ovale. Then this is the foramina spinosum, and remember that through foramina spinosum, middle meningeal artery enters into cranial cavity, and after entering it divides into anterior devian and posterior devian, and these are the groove for the anterior devian, and this is the groove for the posterior devian. Then behind this eminence is the arcuate eminence, and this whole area is the tegmen tympani that makes the roof of middle ear. Now this one is the petrous part of temporal bone, and here you can see this is the apex of petrous part of temporal bone. Now on the apex, just behind the foramina lacerum, there is trigeminal impression, and here is the location of trigeminal ganglion. Now we will discuss about the posterior cranial fossa. Now this one is the posterior cranial fossa, and anterior boundary of posterior cranial fossa is formed by superior border of petrous part of temporal bone on each side, and in median area by dorsum scelli. Posteriorly, it is bounded by squamous part of occipital bone. On each side, here and here, it is formed by mastoid part of temporal bone and mastoid angle of parietal bone. Then floor in the median area, it is formed by sloping area that is known as clivus, foramina magnum, and squamous occipital bone. Then lateral area in the floor, it is formed by condylar part of the occipital bone, posterior surface of the petrous part of temporal bone, mastoid part of temporal bone, and mastoid angle of parietal bone. Now we will see different features of posterior cranial fossa. In posterior cranial fossa, in median area you can see this sloping area. This sloping area is known as clivus. Now important is that how clivus is formed. Now in upper part it is formed by dorsum cilia, that is the part of body of sphenoid bone, while in lower part it is formed by basilar part of occipital bone, and as a whole this is known as clivus. Then behind the clivus, this foramina is the foramina magnum, and behind the foramina magnum, this crest is the internal occipital crest. And on this crest, there is a triangular shaped fossa that is known as Vermian fossa, and it is related to vermis of cerebellum. Then posteriorly, you can see this is the internal occipital protuberance, and here is the location of confluence of sinuses. Now, confluence of sinuses is a meeting point of many sinuses, and from confluence of sinuses, there are origin of right and left transverse sinus. Now, these right and left transverse sinus run in a groove. This is the groove for the right transverse sinus, and this is the groove for the left transverse sinus. Now, this transverse sinus then continue as a sigmoid sinus, and here you can see this is the groove for sigmoid sinus, and here also you can see this is the groove for sigmoid sinus. And where the sigmoid sinus ends, there is the location of jugular foramina. Here is the jugular foramina. Now here you can see this fissure. This fissure is a petrooccipital fissure because it is located between occipital bone and petrous part of temporal bone, and it lodges inferior petrosal sinus. Then just above the jugular foramina, this is the internal acoustic meatus, and this internal acoustic meatus leads into the internal ear. Now this is the superior border of petrous part of temporal bone. Here is the location of superior petrosal sinus, and just behind this internal acoustic meatus, here is the subarcuate fossa. And you can see these depressed part, these are for the condyles of cerebellum, and here you can see these are the jugular tubercles, and behind the jugular tubercle there is opening of hypoglossal canal. So it was all about the different fossas of cranial cavity.